Hey, Mark, you do me a favor. You just stay out here. I'm going to go and assess them and screen them, and then I'll let you know if I need you in there. You can stay out here.
No, I haven't been out of the country. Yeah, I do have a really high fever. No, I don't think anyone around here has the virus, but I'm not sure. I work a lot. I used to be a restaurant server.
911 paramedics.
Yeah, you're here for me.
Call, sir. What's
Yeah.
going on today?
I don't feel good. I'm weak.
Okay. Can you stand up, sir, and walk through the door for me?
Yeah.
I've got a couple quick questions I'd like to ask you. So what's going on today? You sick? Fever, cough? Any trouble breathing? Some trouble breathing? Any abdominal pain or discomfort? Just kind of weak? Really weak? Okay. Have you been out of country or out of state in the last 2 weeks? When did this start, these symptoms? 2 or 3 days? Okay. I'm gonna put this mask right here on this doorknob, okay? So if you can just go and get that and put it on for me, I'd appreciate it. This is just so we can source control and keep you safe as well as me. So both the yellow things go around your head. And now if you'll just pinch your nose for me. Okay. Is anyone here to lock up for you or? Okay, well, if you don't mind, so we're going to walk right into the side of the ambulance on the side door. I'm good, Mark. You can go in the truck. I'm good. Have you been drinking fluids? You taking ibuprofen or Tylenol or anything? Okay. Sir, if you'll use that sidebar and step up for me, you can sit. There's a gray bench on the left side. If you'll sit down for me, we'll seatbelt you in, and we'll be going here shortly.
Ibuprofen is bad. That's why it's.
Yeah. Well, that's smart. 911 paramedics. Hey, sir, how are you?
It's not me.
Okay, if you could just stay there, okay? We're just going to try to keep distance with, what's going on around here.
He's sick.
He's sick? Okay, well, what's going on?
He's not making sense. He's fever. He's been throwing up.
Okay.
It's just been going on for a day or two. He needs to go to the hospital.
Okay.
I'm having a hard time waking him up.
Okay, sir, can you hear me? Can you do me a favor? I'm going to give you this mask, and can you put that on him for me, please? Do you know if he's been out of country the last week or two?
No, but he works at the hospital.
Works at the hospital, okay. Has he had any flu-like symptoms like fever?
Yeah, he has.
He does?
Couple of days, yeah.
Has he had coughing, difficulty breathing?
Yeah, he has. He was complaining to that before he got like this. I just checked on him. I just can't get him to wake up.
Okay. He had chills, night sweats?
Yeah, he's had chills. He's had a fever.
Okay. How long has it been going on?
Like a day.
Okay. Has he taken any medication or got any medical treatment up to this point?
We tried some Tylenol, but that's it.
Okay.
You don't have insurance.
Okay. Sir. Okay, so what I'm gonna do is I'm gonna go get my partner because I don't think he's gonna be able to walk.
Okay.
So we'll get our stretcher. Just know he's gonna come in with a different looking mask. Okay.
Okay.
But his mask and our mask is just for our protection. Okay.
All right, you want me to stay with him?
Yes, sir. Just stay right here. Hey, Mark. He's not able. He has fever, has chills, cough, body aches. So if you do me a favor, he's not able to, so we need your help. Would you keep your mask on, your gloves, and your goggles?
Okay.
We'll get the stretch out ready. We'll bring it up here.
Sure.
And then we'll go in and shoot the man's out.
Okay. Okay.
So, Mark, after that call, I just had a couple of questions maybe you can clarify for me.
Sure.
With some of the changes we recently had here. So the first question is, why did only one provider make patient contact?
Well, our goal is to minimize contact with those potentially infected patients. That way we don't contribute to the spread of the coronavirus. And that'll help flatten that curve so that we and the hospitals, neither one of us are inundated with patients all at once.
Okay, so my next question is, why do you have the patient ambulator walk to the ambulance?
Okay, so for safety reasons, you know that our stretchers are a two-person operation. That also helps us to minimize exposure as well. If just one provider can be with the patient at all times, then the other provider can stay safe and not worry about exposure.
Okay, so then what if they can't walk or ambulate to the truck? What do we do?
So after a quick assessment, if that provider determines that the patient can't walk, they'll call in additional help, and they'll have all the proper PPE on: gown, mask, gloves if needed, or gown if needed, gloves and mask, and safety glasses. And they'll help get the patient on the stretcher. That's one of those cases they'll require more than one provider, and that'll be entering the building with multiple providers.
Okay, so as far as our FROs and first responders, I guess when do we call them? What do we call them for?
So the goal is to minimize exposure. We're only going to call our first responder partners in the scenes in which we absolutely need an extra pair of hands. For example, a critically ill patient or a patient that can't walk, that's when we would utilize them.
Okay, so that last call, we were on scene first. So what happens if the fire department's on scene before us?
Okay, most of the first responders are going to be staging for these known patients, or if they're suspected of infectious disease, and waiting for us to clear them in or either disregard them. However, in the rare case that they make patient contact first, we will still mask the patient if they haven't already, and then move the patient to the ambulance if they're known or suspected.
Okay, so the last call we had was to a house, a residence, and that
Right.
makes sense to me, the process. So the question I have then is, what about if it's a nursing home or apartment complex?
Okay, so if we go to a scene that's within a building, like an apartment or nursing home, the crew's going to enter the building with PPE, preferably have a gown with them. However, once we get to that specific room or apartment, we're going to make initial contact with that one provider, and they're going to be keeping that 6 feet of distance. And then commercial buildings as well, we're going to do the same thing. With nursing homes, I would say that everybody that goes in needs to be in PPE from the time they hit the door.
Okay, so what about certain types of patients that they can't ambulate, they can't even talk? So maybe a multi-system trauma patient or someone who's unresponsive, unconscious, or even if we have a cardiac arrest.
Okay, so we're going to be wearing our N95 mask, goggles, and gloves anyway. So not much will change there. However, if we encounter a patient that's got a high likelihood of possibly being infected, we need to reduce the number of providers in immediate contact as soon as possible. Whoever's on scene and in contact with the patient and doesn't need to be, get them out of there. They need to decon before they get back in their unit. And this really applies to all patients in which we missed it on the dispatch or the initial screening when we go in.
Okay, so as far as our FROs, that's a blooper reel.
Blooper reel.